Frozen embryos transfer is when you are experiencing IVF and have multiple frozen embryos that you may wish to use in future. What is the frozen embryo transfer cycle? Freezing one or more embryos is known as FET cycle. Embryos frozen and kept from the previous treatment and then using those frozen embryos in order to conceive. Frozen embryo cycle recommendation. In order to create number of healthy embryos, a typical IVF or ICSI cycle are stimulated in the ovaries to produce multiple eggs for insemination. But for the uterus transfer, it is only required 1 or 2. Rest can be frozen for the next IVF cycle. In case if the first time transfer does not goes unsuccessful and does not result in pregnancy, or maybe in future to conceive another baby. Sometimes a doctor may recommend to freeze all the embryos and may not suggest to transfer them immediately. If the uterus lining has not been developed to the required point, or if in case if the mother is on the risk of rising ovarian hyperstimulation syndrome OHSS. Most of the fertility specialists may suggest to freeze all the patient's embryos in order that in the later cycle it would be more natural environment and may have healthier chance for pregnancy establishment. It is potential avenue for a mother who has late pregnancy plan and she freezes her embryos and then she can utilize in her 40s or early 40s. But then she may be appropriate for her own by that age. The success rate of frozen embryo transfer. It totally depends upon the number of factors, in which the biggest factor is the woman's age. Usually all or some of the embryos may not be able to survive in the freezing and thawing process. In the case, the cells may get damaged. The survival rate is 90% when the embryos are frozen at the blastocyst stage by vitrification after 5 to 6 days of fertilization. If the freezing process is slow, the survival rate is 80%. During the blastocyst age, if the embryo vitrified is thawed and transferred, it results in the same success rate as a fresh embryo. But there is no single evidence of frozen and thawed embryos resulting in a greater number of miscarriages or any sort of abnormalities. What contains in a frozen embryo transfer cycle? As the mother is ready to begin a FET cycle, she must contact her IVF nurse before. The nurse will study her complete instruction provided by the doctor and would probably help in completing all the paperwork for the treatment. Will may include consent and medical forms. The mother cannot move forward with the treatment if the husband haven't signed and submitted the form. Before undergoing treatment, the uterus lining and endometrium should be in the stage for a natural cycle hormone replacement therapy cycle. Natural cycle. The FET cycle endometrium is naturally thickened as a part of the normal cycle. The cycle is then monitored, checking the development egg follicle on the ovary, as well as the thickness plus size when the ovulation is triggered. The transfer of the embryo then takes place almost after the week after this. The time period depends upon the treatment of the individual treatment plan and the stage of the embryo was frozen. In the second half of the progesterone, vaccine or series is given to help support the endometrium. Hormone replacement therapy HRD cycle. The HRD cycle is used most importantly to control the cycle, particularly in females who are facing irregular cycle. The addition is estrogen and progesterone. Medicines is used in order to develop endometrium to the perfect stage. The doctor may prescribe medications during the cycle. The situation will be monitored by ultrasound in order to keep in check when to present progesterone. The embryos are then planted within a week or after progesterone starts, but this totally depends upon every individual situation and condition, as well as the stage when the embryos were frozen. When embryos are being thawed, the embryos are being thawed by the laboratory so that development of embryo responds at the right stage of the menstrual cycle. Time plays a major role at the stage embryos were frozen. How to transfer embryos. A fine tube catheter is used and passes embryo towards the cervix, which is then moved to the uterus, in which a tiny amount of culture medium is also placed in the uterus along with embryo. No sedation is needed in the technique, and the patient may feel a mild discomfort. After frozen embryo transfer cycle, before you leave for home after the treatment, the nurse will guide you completely, starting from medicines to lifestyle. The blood test is taken within 11 to 14 days of the frozen embryo transfer. This test will measure the human coronary gonadotropin HCG, which is the result of pregnancy. Getting the test done on the said date so that it don't lead to wrong results. You should take the medicine regularly, although any type of FED cycle, until the pregnancy test. In very rare cases, some ladies may experience spotting or mild bleeding before the pregnancy test. This may not be the menstrual cycle but also continue to take the medications which has already been prescribed by the doctor. The Cares and Cures team want you and those close to you to live a healthy, happy life. Your health is a valuable thing. Look after your health and your mind so that you can live your life to the fullest. Remember, you only get one. Please share this with your friends and family and let us know what do you think in the comments below. This video is solely for informational purposes. Do not self-diagnose or self-medicate, and in all cases consult a certified healthcare professional before using any information presented in this video. The editorial board does not guarantee any result and does not bear any responsibility for any harm that may result from using the information provided in this video.